My name is Fu Siong Ng, and I'm currently a consultant cardiologist and also a clinical senior lecturer based at Imperial College London, and also a number of other hospitals, including Hammersmith Hospital and Chelsea and Westminster Hospital NHS Trust. Um, I think I probably decided in my teens. I grew up in a medical family. My father was a GP and owned a GP practice, and my mother helped in the GP practice. So I was very much exposed to what it was to be a doctor and understood the rewards of being a doctor, but also very much saw firsthand the challenges of being one. And having seen it firsthand, I felt that this was a career that I also wanted to follow. I chose to specialize in cardiology quite early in medical school, probably within the first 2 years. In the early years of medical school, we are taught about all the different organs and the systems, and the heart was one organ that particularly fascinated me. It was very easy to understand. All the functions were understandable just if you understood basic physiology. And I was also particularly drawn to this specialty because it is one of the specialties where we have a lot of treatments to help patients. We have a lot of multiple drugs that can prolong patients' lives, make patients better, and also a lot of different procedures that we can do with lots of very advanced technologies to really transform patients' lives. So it's a combination of factors that drew me to cardiology. The thing I find most rewarding about my job is being able to help patients. It sounds a bit cliched, but it's what gets us out of bed in the morning when we feel that when we come to the hospital, we get to speak to lots of different patients, understand their problems, and then have the opportunity and the privilege to do a procedure or help prescribe some treatments or give some advice that can really transform patients' lives. So there's nothing like seeing a patient before a procedure and then seeing them in a few weeks after you've done the procedure and them telling you that their lives are transformed in a positive way and now they can do things that they couldn't do before. Those are the things that I think really drive us. I think my patients most value my communication and honesty with them. So a lot of the time patients come to me and I very much like to involve them in the decision-making process. So because of my scientific background and because of my background in research, I often present the facts to them and also let them know some of the uncertainties around what we're doing. So it's not always clear cut. We talk through the pros and cons of each individual option, what the benefits are, what the risks are, whether we even need to be doing certain procedures, whether they will actually help them. I think that kind of honesty and back and forth discussion about the facts, about their situation is often very much valued by the patients. What I value about my patients, I guess, is the same. And they come to me often with quite significant issues, but they are very honest with me to tell me what they want to get out of it. And it's that patient-doctor relationship that I think is crucial to helping all patients. Once we get that trust built between the patient and the doctor, and we can speak honestly at a very good level, I think that's when we can help patients along their journey.